Our next speaker is Walter Willett, Professor of Epidemiology, Nutrition and Medicine, co-author of 53 publications with Dimitrios, first being Risk of Breast Cancer Among Greek Women in Relation to Nutrient Intake in 1988.
Thank you very much, and it's indeed really good to be here with friends and colleagues and remember the life of Dimitri, who was indeed a close friend and colleague for many years. I'm going to talk a little bit about our work in early life exposures and risk of breast cancer that I hope to think carries on some of the inspiration that Dimitri gave to this area. Certainly breast cancer was one of the central topics of his investigations over the years, and much of that, his interest focused on early life. We have many kinds of data that for many decades have suggested that early life experience is likely to be important for cancers in general, but even more so for breast cancer. First of all, migrant studies, I think everyone here is familiar with this, and particularly interesting for breast cancer in that it usually takes about 2 generations for the breast cancer rates to catch up to those of European Americans when people come to this country from other parts of the world. Second is the association with height. Obviously, height develops during childhood and adolescence, and points to that as being a period of life when exposures might be important. Perhaps the most specific timing of exposure was our radiation exposures, most seriously from Japan, where it's very clear that radiation during childhood and early life is associated with an increase in breast cancer risk during the following years, but after age 40, radiation has almost no effect on breast cancer incidence, pointing to the vulnerability of breast tissue during early years. And then, of course, the early reproductive factors being important for breast cancer, again pointing to that period of life. Dimitri himself has contributed importantly to some of this literature. And this is one of his very early studies from 1969, and it is notable for a couple reasons. First of all, Dimitri's there, and Antonia's on the scene as well. Clearly a very long and wonderful partnership as a family, but also in terms of production in epidemiology, and particularly nutritional epidemiology. And I would also note present among the authors is Brian McMahon, which I think others haven't touched on too much, but this was clearly a very important link that connected Greece and Dimitri with Boston and Harvard. That one of the things, and I mentioned that with Mary McMahon being present with us today, that's sort of the preceding step in this lineage of really great epidemiologists. And one of the things Brian was particularly good at was identifying people who were smart, creative, and potential good colleagues. So this connection evolved out of the international study of breast cancer that Brian organized in his early years. But the data on the bottom are what I was really looking for in this particular paper, showing a very strong relationship between height and risk of breast cancer. So to carry on with this line of investigation, we've developed a series of studies. The first, familiar to all, is the Maine Nurses Health Study, started in 1976 by Frank Spicer, and I joined the next year and was interested in nutrition and started working on development of ways to assess diet and study diet in this long-term study. And as Elio said, many studies have been built around this model and gone beyond what we have done in the Nurses Health Study in many different ways. But again, there are probably 30 or 40 studies of this general design now around the world in many countries. One of the things we did realize, though, pretty early on, was that women were 30 to 55 when they were enrolled in the Nurses Health Study, and so we were missing what the general epidemiology was telling us might be the etiologically most important time of life for breast cancer. And so to address that, we started Nurses Health Study 2 in 1989, started collecting diet in 19 91. We couldn't put everything on one questionnaire. And we're, of course, following Nurses Health Study 2, who participants were 25 to 42 years of age at that time. So it was specifically designed to look at young adult exposures and premenopausal breast cancer that was not being looked at very well in virtually all the other cohort studies. But that still doesn't get us back to childhood and pregnancy experience. So obviously you'd like to start with a birth cohort and follow them through the decades, but as epidemiologists, we do like to see the results of our studies. So we've tried to piecemeal this together in several ways. One is that we, in Nurses Health Study 2 in 1998, sent a very detailed food frequency questionnaire to participants, asking them to complete this to describe their diet during their high school years. And we modified our questionnaire to match up with food availability during that period of time. And then second, in the Nurses Health Study 2, not shown here, in about that same period of time, we enrolled the mothers of Nurses Health Study 2 in what we call the Mothers Study. And this was a quite detailed questionnaire sent to the mothers to describe their pre-pregnancy and pregnancy experience with our participants, and then the first few years of our participants' childhood in terms of diet and physical activity and some other exposures. And we had lots of other variables around socioeconomic status and other things that we guessed might be important. Interestingly, the mothers were the most eager participants that we've ever had. They got notes back saying, this was wonderful to fill this out. It reminded me about the best period of my life. And the response rate was extremely high to that. Unfortunately, many of the mothers had already died, so we should have done that earlier on. I very much wish we had done that earlier on. And then we added the Growing Up Today study, about 25,000 offspring of Nurses Health Study 2 participants, while these offspring were 10 to 14 years of age, and we're following the GUTS cohort along now. So we can look at early life experiences in several ways, and I'll show you some data looking at high school diet of our Nurses Health Study 2 participants and breast cancer risk. We're just starting to have enough follow-up to have some good looks at that data. And then, of course, in the longer run, we'll be able to look at the diets of the mothers, Nurses Health Study 2 participants, in relation to the children in Growing Up Today study. And the Growing Up Today study will, some of those participants are now in their late 20s, and we can now look at their diets during their adolescent years in relation to benign breast disease, presumably a precursor of breast cancer. So by looking at the data in several ways, we do get some information about diet during earlier years. One obvious question, of course, is the validity of the adolescent diet recalled by adults. And we've looked at this in a couple of ways. One, we did have about 80 participants who provided 3 24-hour recalls back in 1993. And then we went back 10 years later and had them complete their high school dietary questionnaire. The original diet recalls being collected during high school time. And those correlations turned out to be reasonably good, not very different actually after de-attenuating for the only 3 days of 24-hour recall, not very different than what we were getting from our food frequency questionnaires asking about diet during the past year. And in another validation study, we asked a sample of mothers of the participants in GUTS about the diet. We asked the mothers about the diets of their offspring participating in GUTS, and actually there was quite good correlation between what the mothers said their children were eating and what the children said they were eating, which is especially not bad because the mothers did not know everything that their child was eating if they're like our kids. So what are we finding now? We have about 1,200 incident cases of breast cancer now in Nurses Health Study 2 following the collection of their adolescent diet. So the diet was collected in retrospect, but we're looking at it in a strictly prospective manner now. So we do see a positive association with red meat consumption, which we didn't see, and I think in general the literature doesn't see associations of this strength when we look at diet during midlife and breast cancer later. We certainly don't see this looking at the main Nurses' Health Study, diet in midlife or later. Now, the question is, does this positive relationship extend into the postmenopausal period? And the number of postmenopausal cases we have is still pretty small. Our first look is that we don't see it. So this may be strictly adolescent diet in relation to premenopausal breast cancer. So with more follow-up, we'll have a clear answer to that question. But still, this is potentially pretty important. One interesting thing is that looking at how much red meat our participants were eating during that period of life, which is what I remember eating too, and it's almost double what red meat consumption is at this period of time. We have really decreased red meat consumption in this country quite a bit if we go back to that period in time. We've done some substitution analyses looking at replacing red meat with other sources of protein, and we see significantly lower relative risks for replacing red meat with legumes, with poultry, and trends for replacing red meat with nuts and eggs. And of course, we're not going to eat a diet of just nuts. So we said, let's create a composite variable of, it's in fact more like the Mediterranean diet of legumes, nuts, poultry, or fish. And if we look at that composite variable replacing red meat, there's about a 23% lower risk of breast cancer during the premenopausal years. So I find this pretty exciting after having spent about 30 years trying to find clear relationships between diet during midlife and breast cancer risk. That's been not an overflowing cup, to understate that, you might say. We've also recently looked, and Miriam Farvid has done these analyses, looking at fiber intake during high school and breast cancer risk. And again, we see a pretty clear inverse relationship there. We have somewhere a number of cases of, again, it's about 1,200 here, with about 800 being in the premenopausal years. And when we look at fiber components, it really seems to be fiber coming from fruits and vegetables and whole grain, where for a lot of our analyses, we see mostly associations with just whole grain. These are the associations for vegetables significantly, and fruits significantly inverse for fruits, not significantly, but tending that way for vegetables. And of course, alcohol is the one thing that has really shown up loudly and clearly in pretty much all epidemiologic studies. And one concern is about alcohol consumed at young ages, when the breast tissue is, as we see, more sensitive. And this is what we've been able to look at in guts so far, just with 57 cases of benign breast disease, but the relative risk is about almost 6 in this analysis for quite moderate amounts of alcohol consumption. This is some analysis of looking at protein sources in relation to benign breast disease, again suggesting that the more vegetable sources of protein are related to lower risk of breast cancer. Now, going back to height, this has been confirmed in our pooled analysis of prospective studies of diet and cancer, which raises the question, what drives height, or what determines height? Obviously, genetics has a role, but we know from migrant studies there are very strong non-genetic factors. And it really, in this, we could look at relationship between aspects of diet and height velocity quite clearly in guts with large numbers of participants. And the answer is it's milk. And really nothing much else seems to be determining height, even the same amount of protein from red meat. One remaining enigma here, this is one of the very first papers prospectively from the Nurses' Health Study. And what we saw was, quite to our surprise, strong inverse relationship between Quetelet's index, now we call it BMI now, and risk of breast cancer, particularly for, in fact, limited to premenopausal women. And that, as I think everybody knows, has been reproduced time and time again. And as we've dug down to this more deeply, that was at BMI at age 18 or current BMI and midlife, all those are inversely associated, but bring this down to age 5 and 10, we've used these pictograms developed by Stunkert and all, where people rate how they look, and then we can look at their pictogram rating in relation to breast cancer risk. And this is one of the strongest relationships we see for an exposure in breast cancer, about a twofold difference in premenopausal breast cancer across the pictogram levels, and it extends to postmenopausal breast cancer. One of the latest twists to this is using a genetic risk score for Mendelian randomization analysis. This is in the publication pipeline. Now, this does confirm using the genetic risk score for adiposity to look at risk of breast cancer. And so we see clear inverse association for childhood obesity, but also for adulthood obesity. And that also points to one of the problems with Mendelian randomization. If you didn't really know that obesity is positively related to breast cancer, you would get the wrong impression if we were only relying upon the Mendelian randomization method. We don't know, we don't fully understand that, and that's, I think, one of the challenges before us, that Phil Cole once said, breast cancer is not just a humbling disease to study, it's a humiliating disease to study. When you think you've got the truth, it turns out the opposite is the truth. And that certainly turned out to be the case for BMI and breast cancer risk. One clue is that IGF-1 does seem to be part of this picture, because when we look at those pictograms at age 10 and then IGF-1 levels in age 30 to 40, there is very clear inverse relationship there, and I think tying in to some of the data that Chung presented earlier. And one tantalizing slide so far about our only analysis from the mother's cohort is that there's a very strong relationship between maternal smoking and adiposity for the rest of a woman's life. Really quite strong relationship, about a twofold increase in risk with maternal smoking for BMI adiposity at age 18. So to conclude, the recent findings confirm the importance of early life exposures for breast cancer. Healthy diets during adolescence should contribute to reduction in premenopausal breast cancer and maybe cancers later in life. More studies are needed of early life exposure in breast cancer. So far, there's no other cohort that can confirm these findings because nobody else has the data. So one of my pitches is to try to collect such data in other cohorts. And the strong inverse relationship between early life adiposity and breast cancer remains an enigma. So I will end with the same slide as others have shown. We are really missing Dimitri as a friend and as a colleague, but one thing that actually wasn't quite mentioned was he left behind him a couple generations of epidemiologists here and in Greece, and that will keep us connected for many, many years. That was, again, one of Dimitri's great contributions, is leaving behind a tremendous group of people who are strong and well-versed and also wonderful colleagues. Thank you.